Thank you, CAN members, for joining us for this year's first Need to Know. We wanted to take the opportunity to go through the accomplishments that we achieved in 2015. For the new members, it's going to be a summary of what we accomplished. For those of you that have joined since the beginning, it's going to be a little reminiscence of everything that we have accomplished and be grateful that we have accomplished it. So Larry's accompanying me today so we can make this a little bit dynamic and go through the different milestones that we accomplished. So without further ado, I think that one of the major accomplishments was the website that we brought up for the members. How the website offers the ability to log in and have a back of the house username and password for our members, where we display private information to our network. Has information about our vendors, our network, our preferred vendors, ability to network among us, and to post things. And in the future, it's going to have much more things, but for now, it has that. We have the online application.
Yes. Our online applications for our members is now on our website. You can sign up, fill out the demographic sheet, and Kathy will then send you the application, and everything is now automated for our members, and that has made a big difference in people accessing www.pedscan.com.
Fantastic. Mm-hmm. We actually accomplished a very good contract with an EMR company called Office Practicum that is offering a seamless communication with our Health Information Exchange, and they're giving value discounts
at an excellent rate, I would say.
Pretty good. Yep. It was a huge milestone to accomplish that. Our conference.
We held our first annual conference May 30th. And well attended with over 100 physicians and many other support practice personnel. Lots of sponsors involved. Had some excellent presentations by our board, as well as our Quality Improvement Committee, Dr. Afan and Dr. Selsky. And overall, we got some excellent feedback regarding that conference.
Mm-hmm. Regarding our clinical integration network, we have about 100,000 lives uploaded to it. The team is our quality improvement team is working on the different care plans to use the data, and we'll have more to come on that. Now the alliance with the
Clinical Alliance Network has a collaboration with an IPA here in the Orlando market called the IP Network, Integrated Independent Physician Network, of almost 1,100 physicians and 7 counties, and with the addition of our CAN members, which is 101 pediatricians in the Tri-County area of Orlando, makes our IP network to do value-based contracting for this area over 1,160 physicians.
Big accomplishment.
Yeah, big accomplishment.
Regarding networking office to office, there's been several fantastic opportunities that have presented themselves by reaching out to me, to Larry, to part of our board members asking for advice. We've helped several practices learn from the experience of other practices.
And the goal of the network office to office is basically, once our health information exchange, the bridge, is fully operational and interoperable for all of our physicians. You're talking about online referrals, secure messaging, and supporting each other within the network, particularly when we bring on all the pediatric subspecialists that we're going to be working with throughout the CAN network.
Exactly. Other accomplishments have been fantastic agreements with medical supply companies to give substantial discounts for our members. It was a huge accomplishment. It took us about the better part of 2015 to accomplish that agreement with checklist and basically making sure that we have some audits in place to make sure that everybody does receive the same pricing and discounts, and they're competitive. We reached with malpractice insurance companies some very valuable discounts that we have practices saving close to $5,000 and $6,000 a year per doctor. We've reached some key contracts with companies that offer added value to the practice to bring in extra revenue and do very good medicine, like some depression screening companies. Very good programs. For those of you that may have not noticed it, it's on our website. It's something relatively new to 2000. We incorporated the last part of 2015. We have a vision screening. We accomplished a contract with a medical waste disposal company. We have a office supply company. We're talking huge discounts. We have practices that are reporting easily $10,000, $15,000 a year in discounts just in 2015, and some of them didn't join till after June of 2015. But nevertheless, because of the size of the practice and the volume of supplies that they buy, they have reached milestones of $5,000 to $10,000 in discounts. Huge buying group power with vaccines. We aligned with two major vaccine companies, actually buying groups that offer discounts for people that are on either a Merck vaccine schedule or a Sanofi Glaxo schedule as well.
Let's talk about the contracts for a minute then. You know, we've been in discussion with both the major health systems, Florida Hospital and Orlando Health, trying to work with them. Some have gone better than others. I think the jury's still out on what our collaboration or relationship is with either one of the hospital CINs, but through the alignment with the IP network here in Orlando, we have now negotiated contracts with both Cigna and Blue Cross that will be starting up late first quarter, early second quarter, no later than April 1 for value-based savings. And it's going to definitely improve the reimbursement to our physicians on both those payers.
So in 2015, the accomplishments were negotiating these meetings with the insurance companies.
Yes.
And several of them happened.
That's correct. And also we have contracts on the table to be executed with Amerigroup and with Multiplan. Very good rates. You'll be seeing those rates as we send the opt-out letters for you to participate, as well as the Cigna and the Blue Cross contracts. And we are also talking to United Healthcare. So those are some big milestones. And, you know, I'd like to say at this time, I think a real thank you should go to Alberto and our board of directors and also our executive committee for all the evening meetings, phone calls, board meetings that we've had here at the office, and all the input that they have participated in. And also a thank you to Dr. Afan and Dr. Selsky for taking the lead on our quality improvement committee. These guys deserve and ladies deserve a tremendous thank you from all 125 plus pediatricians in the network, that you were the founding organizational people that made this all happen. And I'm just honored to be a part of it.
I agree 100%. Larry, as a president of CAN, I know the countless hours that you've spent on phone calls, negotiating with payers, with buyers, representing CAN, even in Washington as you network in meetings. And that is truly, we're really grateful, and that was a huge accomplishment in 2015. I think that our network has gained the respect and recognition of being a valid network to be able to hold our own contracts with the insurance companies, which is huge.
It's about branding the network and exposure of the network for people to know who we are. And I think everybody in Tallahassee And Washington, thanks in some part to Dr. Afan as well for the work he's done, as well as CMS and some of the contacts that I've made in Washington as well as all the major payers in Florida. And I can tell you 2016 is going to be our breakout year when it comes to this type of stuff. Also for 2016, when you look at the possibilities, many of you know we're negotiating with a group out of North Carolina that actually did win the Practice Transformation Grant thanks to the hard work and leadership that Dr. Afan has done. COSEC is the group, and we are finalizing how our relationship with our pediatric network is going to be with them on a conference call later on this week, and should have some announcements to the membership after that call.
So that's a perfect segue into the what we look forward to accomplishing in 2016.
Yes.
I mean, right off the bat, we've been recognized as a network worthy of participating in this grant that's been given to CMS to be able to accomplish a health information exchange.
Right.
That has.
Well, that all deals with how we are connecting our members through our HIE, and possibly the HIE MD Insight that this grant that won $15.8 million in that CMS grant actually did. We're in the process of deploying our care plans, finalizing our negotiations with our major payers for value-based contracts, finalizing our after-hours call center, which is going to be a huge piece of the everything that I hear from the payers is, as a large pediatric network, what are you going to do to keep kids out of the ER?
Exactly.
And that answer is our after-hour call center and the integrated process through our HIE, the mobile apps and all the things that we're going to do to educate our moms and dads with our kids throughout the state of Florida.
Yeah, we're hearing it's a lot about value care. It's a lot about patient education. So that's why we want to deploy in 2016 a patient education network via a TV network, installing hopefully in everybody's exam room, waiting room, a TV that's a network that the CAN network is going to feed with content. So we have a value relationship with a company called Medical Media that we're right now negotiating those contracts. There's several contracts we have on the table.
Correct.
That is going to take so a little bit of due diligence and board meetings to get those accomplished. But we're talking about employee benefits through a company that offers payroll services and HR services.
Sure.
That's soon to be negotiated. We're talking about alliances to throw resources at every practice that should be patient medical home. And that patient medical home is, it's thousands of dollars of resources that we find that companies are willing to give us an assistance in every practice to accomplish that.
Well, speaking of that, Alberto, there's no question that our physicians can provide more services than what they're currently providing in their offices and improve their practice revenue tremendously. And some of our docs are doing it better than others, but we're going to try and lead in that arena to inform and educate our docs as we move forward in this process. There's a lot of great things happening. In our next couple of newsletters, we're going to be highlighting some of these things that we've accomplished for 15 and also our goals and objectives for 2016 over the next couple of newsletters that we're going to be sending out.
A major accomplishment is being recording these face-to-face videos that help us. You guys actually put a face and a voice to what's going on and see us more often than just once a year when we pass by the office. We've gotten tremendous feedback. Everybody that calls me tell me we just love the videos. We love the frequency of the videos. We love that you guys come out and speak and we hear you and see your face.
Sure.
So
I think, Alberto, I think to kind of close this out, 'cause it's getting a little long, we're having new physicians join CAN every week, and a lot more to come.
Yep. So we added the specialists. We opened up to the specialists, and we're getting them joining left and right because they want to be part of the value-based referral network.
Right.
We have also an alliance. I know we're going to try to keep this short. We have an alliance with some business bankers that want to extend, bank loans, equipment loans, anything, and even do feasibility studies for any practice that intends to either add another office to their network, add physicians, buy more equipment, remodel. They'll do an entire feasibility study for absolutely free. They do the whole business plan to make sure that you're making a conscientious decision on your expansion of your office or remodeling of the office. We have 3 or 4 different alliances with labs, imaging companies that are coming forth. And these are people that want to be part of an independent network. So all that's to come in the year 2016.
Right.
And little by little, and the newsletters and the videos that come out are going to have details on how those are going to be accomplished.
So more to come.
More to come.
Thank you.
Thank you for joining us, and we look forward to a prosperous 2016. Thank you, and God bless.